of inviting Dr. S. Chandrasekhar, Dr. Ravindranath, and Dr. P. Krishna Prashanti on stage to chair the next session, please.
Everybody must be remembering the history. The blood pressure medication, how it has been started being used for blood pressure. Blood pressure medicine being used for blood pressure. So Viagra has put in Niagara into many lives. Now I invite Dr. Asirwadam to emphasize, canvass and declare about new drugs which can be used for other indications.
Respected Chairman, my teachers, Professor Sundaram, dear friends, thank you very much for giving me this nice opportunity and the topic which is quite interesting, off-target usage of anti-diabetic drug. Even before the slide starts, I don't want to waste time so I can go ahead. But every time Dr. Sundaram used to say that if you are going for attending a conference, just study about all these topics, without which it's going to be a waste. Same way, I always used to read and come by heart for any presentation for that matter. So no problem, even if you don't have a slide, I can finish off within 10 minutes. So off-target usage of anti-diabetic drug means that everything is directed towards a target or achieving a goal. But some of the molecules, that's fine. So this is achievement of a target is very important. But sometimes you see something going astray and they are called the off-target usage. So, but anti-diabetic drugs are versatile drugs which could probably do both the things together, target effects as well as off-target effects. And we'll be discussing about the off-target effects today. So I will classify into the oral anti-medications, anti-diabetic medications and parenteral medications. And here you have metformin, the first drug, sulfonylurea, bromocriptine, and the entire list of oral hypoglycemic agents. How could metformin be useful? Right. It reduces hyperinsulinemia, as you know, and very useful in reducing the overstimulation of the ovaries by the high insulin level and prevent from PCOS. The second important thing is when you give this particular drug, when compared to sulfonylurea and insulin, you get a better advantage of reducing stroke. The third thing is it's an anti-atherogenic drug. So it has a lot of effects of anti-atherogenic drugs. And it reduces lipid accumulation in the vascular intima as well as in the leukocytes, which is going to help you in prevention of atherosclerosis. And it also improves microvascular circulation as well as prevents cancer by one important tumor suppressor, what is called the LKB1. So it has an anti-cancer as well as anti-atherosclerotic, anti-stroke as well as in PCOS. Next important drug is sulfonylurea. Sulfonylurea is still an old drug and old is always gold. And here you see tolbutamide. It is a dermatologist-friendly sulfonylurea. It is used in vitiligo. And chlorpropamide has one important factor called chlorpropamide alcohol flushing syndrome, that when the patient is on chlorpropamide, the patient, when he takes alcohol, he produces a lot of flushing syndrome, which is an important marker that you will not go in for nephropathy. It could also be used as an antidiuretic effect for diabetes insipidus. Then glibenclamide, the original gold standard anti-diabetic drug, also has one action through DIRA. And this is probably the incretins which we never knew those days. Glipizide has an important advantage of prevention of mesangial expansion, which also says that it could prevent nephropathy. And gliclazide, by its cross with the chain, antioxidants in the chain, it is able to prevent nephropathy as well as to give a good cardiovascular risk reduction as well as an extra leash of 8 years. And coming to glimepiride, it has got effect beyond beta cell on the peripheral cell by increasing its action through the caveolae, almost like an insulin mimetic action. Plus, it has got a very good, wonderful evidence that it reduces the tumor necrosis factor, PAI, and also increases adiponectin. In that way, it is also favoring an anti-atherogenic approach. And coming to bromocriptine QR, the first drug which passed through FDA, has a very good cardiovascular risk reduction of almost 42%. And thiazolidinediones, the wonder drug, however, it's always a controversial drug from the beginning till the end. And thiazolidinediones have a very good endothelial protection, which is able to protect the endothelium from damage. and it has got an anti-inflammatory action by suppressing all the inflammatory markers, and blood pressure reduction by a few millimeters, which is almost equal to an SGLT2, and also the intimal hyperplasia or hyper thickening of the intima is also prevented by preventing the proliferation of the smooth muscle cell into the intima, and thereby giving you an anti-atherosclerotic process as well as pro-thrombotic state by in reducing the inflammatory markers. Next comes the DPP-4, which is again very useful molecule, the fashion of the day, reduces triglyceride as well as improves the short-term memory. So probably later on when we become old, this tablet will also be useful in helping in improving the memory as well as reduce the inflammatory response and increases the neural cells or neurogenesis. Coming to the SGLT2, the latest heroine, you have multiple actions of SGLT2 apart from the target effect. It is a uric acid reduction, HDL, LDL in a favorable direction, a reduction in triglyceride, as well as a reduction in oxidative damage, as well as weight reduction and visceral adiposity reduction, and also you have a sympathetic activity which is also reduced. So all these packages come with the target action of glucose reduction and insulin independent action. So this is again a drug which has lot of off-target role. And coming to HYQ, or the molecule which has been primarily an anti-inflammatory molecule, the chloroquine derivative, and it's an anti-inflammatory molecule which has been used for lot of anti-inflammatory effects like rheumatoid arthritis and polyarthritis, has now been coming into the diabetic arena, and here this could also be used in diabetes as well as even in non-diabetic patients for the arthritis benefits. And coming to the parenteral usage, insulin, as you know, is an anabolic and anti-catabolic hormone, thereby replenishing the muscle mass, the fat contours as well as the body weight. So as it was also pointed out by Professor Ramachandran, there is more patients of ours are insulinopenic. They have less of muscle cells, so it is called sarcopenia. And for these patients, they also be benefited by insulin therapy. And this insulin is not only for the improvement of blood glucose control, but also to give them a good appearance. So a patient who has been started on insulin always puts on weight, has a good subcutaneous fat, and thereby a good contour, so that patient doesn't look like a diabetic. Otherwise, sometimes patients are not very happy, but you are happy because the blood sugar is all right. So wonderful use of insulin there. Previously, when we were all students and house surgeons, we used to just apply insulin, short-acting insulin over a raw wound. And this is mainly meant for improving the granulation of the particular tissue. But today, it is not used because we have got endothelial growth factor, platelet-derived growth factor, which could be probably used in this indication. And insulin could also produce erratic absorption of insulin. Then, the important entity of human sequence insulin, which is a therapeutic drug for lipodystrophy, which is caused by an impure insulin usage with lumps and bumps in the thighs, shoulders, and other places. So that it becomes another important indication for the usage of this insulin and an off-target role. Then coming to insulin tolerance test, which is also a test to identify the growth hormone hypofunction, which is going to be in hypoglycemia, which is induced, and the growth hormone should surge out. It should just come out in a large amount. If it doesn't come, that means the growth hormone secretion is affected. So in that way, this also has one more indication. Coming to GLP-1 receptor agonist, the latest drug has shown a cardiovascular reduction, and probably just like SGLT2, which is now being robbed by cardiologists. This molecule also maybe in halfway through would be robbed by cardiologists because of the cardiovascular risk reduction and obesity reduction. And this drug has been patented for an anti-obesity drug in abroad, but not in India so far. And it has got a favorable lipid alteration. So dear friends, to conclude, the most of the anti-diabetic drugs are versatile drugs, and which is not only having effect on the target organs, that is a target which is glycemic control, but also at multivarious non-target effects. So probably we should not call it as an off-target, but maybe it is a non-target effects. And these effects are really useful in every diabetic patient to give a holistic treatment of diabetes. So with that, I would sincerely thank Dr. Vijayakumar for having given me this opportunity And I think I have been able to push in within the allotted 10 minutes in spite of some technical problems here and there. And I sincerely thank all of you for your patient listening. Thank you.